Now, lots of people have asked me to make a recording about how we look after sick people at home. So if someone gets a respiratory virus at home, how do we care for that person? Now, you can't teach medical and nursing care on the internet, but we can look at some principles that can help your thinking at home. And I want to do this under some headings that I've drawn up here. So these are the headings I've drawn up for care at home. First thing I want to look at is how we protect others. So if there's an infectious disease in the house, we want to protect others and those in the immediate environment. The next category we want to look at is nursing the sick person. Then we want to think about observation of the sick person. And then we want to think about possible complications and getting advice or help when that is required. So first of all, let's start off with thinking about protecting others. Now, if there is a respiratory virus around, then that's going to be infectious, and it's a droplet infection, and it's given out to some extent in aerosols. And it's also going to be breathed out and coughed out by the infected person onto surfaces, meaning that other people can pick it up in their hands and get it in their mouth. So that's sort of the principles we're thinking about. Now, for example, if we're talking about a partner, then they should sleep in a separate room to reduce viral load. So with quite a few infections, how poorly you get from an infection depends not only on whether you contract this virus, but how many of this virus, how many viral particles you contract. So if someone's sick, the person that normally sleeps in the same room or the same bed as them, if at all possible, should sleep somewhere else. Now, how you do this at home is very much going to depend on the accommodation you're in. If you're living in basic accommodation with a large group of other people, this is going to be remarkably difficult. If you live in a nice chateau in the rural French countryside, it's going to be much easier. So you're going to have to try and apply these principles to your own particular situation. But certainly partners should not be sleeping in the same bed as a person with a viral infection, so that their viral load that the partner gets is going to be reduced. Now, these viral infections are going to be infectious for some days before the person becomes ill and for some days after the person becomes ill. So if two partners, husband and wife or whatever it is, have been sleeping in the same bed for a few days and then one of the partners becomes sick, then the other one could well probably be infected already. But it's still a good principle to reduce viral load until we know what's going on. So keep the sick person in a separate room and keep the door closed, because the virus can be suspended in the air for a period of hours. So we need to stop the viruses from drifting out into the rest of the house. And also, if a window is open, as long as it's not too cold, that will dilute the virus that's in the air. So that's another good thing to do. But remember, the surfaces in the person's sick room will be contaminated as they cough and sneeze and breathe to even, especially the immediate sheets and covers and surfaces close to their mouth should be considered particular points of potential infection. Now, if it's warm enough, I think you should get some sun if possible, because getting the sun on the surface of the skin is going to increase the amount of vitamin D that's produced. As long as you don't get sunburnt, that's a good thing to do. No question for adults. I would certainly do that if I had any sun. We haven't today. It's interesting, a lot of people were nursed outside in the 1918-19 pandemic, and there is anecdotal accounts that was helpful. Now, this virus can be excreted in the stools, in the faeces. It can inhabit the gastrointestinal tract as well as the respiratory tract. So good toilet hygiene is essential. And when the toilet is flushed, the lid should be put down, because flushing the toilet, all the water is going to come into the faeces and there's going to be some aerosolization of the virus. So great care with toilet hygiene. Viruses may still be excreted in the faeces after recovery. So this needs to go on for some time. So it's quite possible a person is feeling better, but still excreting virus in his or her feces. Now, if you've got several bathrooms in your house, wonderful. You give the sick person their own bathroom. If not, you've got to be meticulous about hygiene, but they should certainly have their own towel, their own face cloth, things like that. Separate them as much as you can. Now, when someone's nursing them in the sick room, they should be wearing masks, and the sick person should be wearing masks. Gloves if they're available, and also because the virus can be in the air and go into the eyes, people nursing the sick person should ideally wear goggles to protect themselves, or some sort of eye protection if that's available. So if there's a limited number of masks, I think it might be best, although this is just my opinion, to give them to the person that's sick, because they're going to be coughing and breathing out the virus. But ideally the sick person and their carers should be wearing masks, and the carers should be wearing gloves and goggles if possible, as well as practicing meticulous hand hygiene, of course. And then remember that the virus can be coughed out onto clothing, so wear protective clothing and wash it regularly. What you could even do is have a diluted antiseptic or bleach solution in the bath, then, because the diluted bleach, if it's the correct dilution, will kill the viruses on any clothes. Or wash them regularly. Or if you can't wash clothes regularly, have the same coveralls that you can use to go into the sick room. But remember, there are cases of virus spreading from infected, contaminated clothing of the carers. Take a shower after nursing the sick person, as well as meticulous hand hygiene where possible. Hand hygiene, as we've talked about many times. Disposal of waste from the sick person is absolutely vital. So the sick person should have a plastic bag in their room. When they cough or sneeze into a tissue, they should put that into the bag, and then they should tie the bag up and seal it, so it can be disposed of as hygienically as possible. And the virus can also go onto bed sheets and bedding, so be great care with that. So when the bedding's being changed, fold it up gently so the virus isn't wafted into the air, and fold the virus in, and then just put it into a hot wash. Hot soap and water will then kill the virus. So a lot of things to think about there in protecting others in the household and others in the immediate environment. So remember, viruses can hang in the air for a period of time. Opening the window will dilute those viruses, so fresh air is very important. Now we think about nursing the sick person themselves. When a person has a viral infection, they could have a fever and be losing more fluid. So a good fluid intake to make up for losses. And also a good fluid intake does two other important things. A good fluid intake will keep the mucus lining the respiratory tract thinner and moister compared to someone who's dehydrated. And this means that these cilia, these wafty hairs, can waft the mucus out more readily. So what is called the mucociliary clearance system, the combination of the mucus and these cilia hairs, are less able to waft out mucus in dehydrated people, more able to waft it out in people that are well hydrated. So keep well hydrated. And you know you're well hydrated because you're producing large volumes of clear, dilute urine. So ideally you want to be producing several litres of urine per day. That should be clear and diluted. Now trials are ongoing, and there's some trials already that shows that vitamin C is of some advantage in some viral infections. So I've certainly no advantage for people taking vitamin C, and personally I take vitamin C when I have a viral infection. Now as long as you're drinking plenty of water, it's a fairly safe thing to do. If you take a lot of vitamin C but you're not drinking plenty of water, then the vitamin C can actually crystallise in your kidneys if they've got very high doses. But as long as you're drinking plenty of water, that should wash that out. And vitamin C is a water-soluble vitamin, so it's just washed out in the urine if you take too much. Now, people fuss a lot about eating. I was just talking to someone recently whose husband was ill, and she said, I just can't get him to eat. Well, that's fine. So when you're feeling ill, if you want to eat, eat. When you're feeling ill, if you don't want to eat, don't eat. And this is true for the vast majority of us. For sometimes in children it's not quite true, but this is for adults, and it's for me, going without food for a few days will do me no harm. In fact, it'll probably do me quite a lot of good. So don't worry about it. In fact, it's normal to be anorexic. Anorexia means the person doesn't feel hungry. So when people are ill, it's perfectly normal to be anorexic. And it's perfectly normal that the body becomes what we call catabolic. Catabolic means breaking things down. So stored carbohydrates, fats and proteins can be broken down when someone is ill to help the body fight off the infection. Now, we could talk about fever management for the next 6 months. And I'm not going to advise you what to do with your fevers. That would be sticking my neck out a bit. But I'll tell you what I do. If I have a viral infection, I try not to reduce my fever. Now, whenever someone comes into hospital, if they have any form of infection, of course, we always take the temperature. And quite often that temperature is normal. And I always say, well, when did you last take paracetamol or ibuprofen? Because if they've taken either of those two preparations, then the fever may well be absent, even though they did have one before they took the non-steroidal anti-inflammatory drug or the paracetamol. So in respiratory viral infections, I think you're best not to take ibuprofen, especially because that's anti-inflammatory. A lot of people recommend taking paracetamol, that's Tylenol or acetaminophen, and that will bring your temperature down and make you feel better. But what I always remember is that the reason that the temperature has gone up is a deliberate mechanism of the body to increase the temperature, and the immune system works better at these hot temperatures. So my view is that if you reduce your temperature, you are reducing the efficiency of the immune system. You'll feel better, but the condition could last for longer and there could be a greater risk of complications, in my view. So remember, fever is the body's natural response. And a lot of people ask me, when is the fever too high? Well, in most viral infections, your fever won't go too high. So as long as your fever is under 40 degrees centigrade in an adult, I wouldn't be too worried about my fever if it was under 40 degrees centigrade. So people are terrified that fever is going to go higher and higher and kill the person. Well, the fever is normally self-limited in most infections. And in viral infections, that's usually true. So monitor the fever by all means. But if my fever was 39.5 or even 40 degrees centigrade, personally I would try not to lower it, because I know that is improving the efficiency of my immune system. Keep warm, because warm body temperatures help the immune system, and it also makes the environment less comfortable for any infecting viruses or bacteria infection. Because remember, in viral respiratory infection, there's always the risk of secondary bacterial infection as well. Now, best position. So ever since when I was 18, I learned that when people have got a chest infection, you should sit them up. So if you lie people flat when they have viral chest infections or any chest infection, the teaching has always been these people are more likely to get pneumonia if you lie them flat. So we always want to prop people up on pillows, as long as the blood pressure is enough to keep their brain perfused so they're not feeling dizzy. So very often with chest infections, the best position is sitting up. That can also help people to breathe, and it can help coughing and expectoration as well. And some studies have shown that lung drainage works better as well if you have some time lying on your tummy. So sitting up or lying on your tummy is probably the best position, alternating those and deciding where you feel comfortable and where the breathing is easiest. What we don't want to do is spend large amounts of time lying on our backs if we have any form of respiratory infection. Anything else to say about nursing the sick person? Of course, if we have specific treatments for the infection, then wonderful, give the specific treatments. But for most viral respiratory infections, alas, specific treatments are limited. But if there is one, of course, take it if there's a specific treatment for the infection that you have. Now, observations of the sick person are very important. Now, observations, it's not just so much the observations. What do we mean by observations, first of all? Well, observations are the temperature, the pulse, the respiratory rate, what we call TPR, temperature, pulse, respiratory rate, blood pressure and the oxygen saturations. Now, what we're interested in these is not just what they are, but if there's a trend. So we need to follow trends. So, for example, if we have a rate here and we have time here, and we find that the respiratory rate is going up, then that is a very important observation, because we're noticing a trend. So serial observations are important because that can give us trends. Now at home, I think most people can take a temperature, hopefully. I've got this nice electronic one. You can get these relatively cheaply now. We're not supposed to use mercury ones now, but there are other thermometers like electronic thermometers under the tongue and things. So having some device to take temperature at home is a good idea. Most people can find a pulse. There's a pulse here in the wrist. I've shown you how to do that before. If that's your thumb there, there's a bone there, there's a tendon there, fingers in line there with the thumb, and you press on there, and that is the radial artery. And you can feel that in there. You can press on that. And pulses are like anything else. You just need to practice. Now, respiratory rate, it's important to know that one respiration is one breath in and one breath out. That is one respiration. A lot of people have blood pressure machines at home, so if you've got one of those, by all means. And more people are getting these at home now. Now, to check the oxygen saturations, you have to have one of these machines, these saturation probes. But these are quite cheap now. I think I got paid about £20 for this. So that tells me my current heart rate and my current oxygen saturations. So my current heart rate is... Settle down now. Good. So my current heart rate is about 73. Yeah, we'll go for 73. That seems to have settled down at that. And my oxygen saturations are 98%. So that's good oxygen saturation. So sort of 96 to 100 is kind of normal. As long as it's over 94, we don't normally worry too much about that. So that's my oxygen saturations. But you need one of those machines for that. But as I say, you can get those now, and there's no reason why you shouldn't have one of those for the home. They're readily available online, certainly. Respiratory rate normal is 12 to 20. Now, actually, in many infections, the respiratory rate is the most important clinical indicator you can watch. So just counting someone's breathing rate, one breath in, one breath out is 1. Now, it's important to monitor the volume of urine, colour and volume of urine, because we want to make sure the person's well hydrated. We want the urine to be light coloured, and that means the kidneys are working well, and it means the person is well hydrated, and we've looked at why that is important. And also, if you drink lots of water and you're producing large volumes of urine, the kidneys are much happier than that. The kidneys actually have to work harder to produce smaller volumes of urine. It's a bit counterintuitive. So the kidneys are having an easy time if you're drinking lots and lots of water. So remember that. The smaller the volumes of urine, the harder the kidneys are having to work. So drinking large amounts is good. And record progress of condition from day 1 of the onset of symptoms. Now you want some sort of evolution of the disease here. So you could have like again, you can keep a note of this. So day 1 is the day the person first develops symptoms, and you could have so that could be day 1 there. Then you could make notes for day 2 there, and so on, and make notes for what happens on which particular day. Remembering day 1 is the onset of symptoms. And if you need to ring a doctor or talk to someone, it's very helpful if you can do this. Say, well, on day 1 this happened, on day 2 this happened, on day 3 that happened. So those observations are useful to make. There is videos in this series where I've looked at these in much more detail. Now, complications, getting help and advice. Now, of course, anytime you're sick, get all the help you can. Call doctors, call your district nurses or whoever you have available, call your helplines, get all the help that is available to you. But part of the reason I've been asked to make these videos is we know that there's people in some situations where help is limited, especially in some poorer parts of the world. So when would we be getting worried? Well, with respiratory infections, what we're worried about is the development of something called acute respiratory distress syndrome, or we're worried about pneumonia, or potentially a form of a septic reaction where other organs of the body are attacked. Not so much by the virus itself, but by the body's inflammatory response to the virus. So if the respiratory rate is increasing beyond 20, then you should contact a doctor about that. Get someone on the phone that you can talk to and be advised by them. So 20 to 30 breaths per minute or higher, of course. We call this tachypnea. And this could be a sign of complications developing, such as pneumonia. And also, if the oxygen saturations are dropping, say less than 94%, that would be a sign that would be concerning, because again, that could mean that pneumonia is potentially developing. So these air sacs, these alveoli in the lungs, could be collecting fluid. And that means the oxygen can't get into the blood. And it means the carbon dioxide can't get from the blood back into the alveoli. It means the lungs aren't working properly. And of course, you can only monitor oxygen saturations if you have the oxygen saturation probe. Now, is the person talking in sentences? So at the moment, I'm able to talk to you in sentences. I'm not gasping for breath and stopping in the middle of the sentence. So this can be a useful indicator that someone is getting enough air in. So if someone is breathing very quickly, they won't be able to control their breath sometimes enough to talk in sentences. We use this a lot in people with asthma. If they're going, just saying the odd word at a time rather than talking in fluid sentences, that can be an indication that that they are having difficulty with their breathing. Now look at the normal colour of lips. Sometimes under the eye there, the colour of the cheeks, the colour of the tongue. Look at the normal colours of the people around you and look for that pinky colour in their lips. Now, if there's a blue tinge to the lips, that means the oxygen saturations are actually very low, and that would be an absolute emergency situation. You need outside help immediately with that. So look at the colour of the lips, look at the fingernail beds. And a useful thing to be able to do with fingernails is just squeeze them, and you'll see that they go white if you squeeze it. See my fingernails gone white there. I'm going to focus. Then when I let go, it goes pink again. So that's called capillary refill. So you squeeze for 5 seconds, then you let go, and it should go pink again in under 2 seconds. That's a good indication that the circulation is not too bad. And also the colour of the fingernail beds. Again, can you see mine are a nice pinky colour at the moment, indicating there's reasonable levels of oxygen in that blood going through my fingernail beds. If the temperature carries on increasing, that could be another indication of possible pneumonia developing. The pneumonia that develops can be a viral pneumonia. It can be this acute respiratory distress syndrome, and as well as that, you can get secondary bacterial infection. And it's very important to know about this because, of course, we're absolutely brilliant at treating secondary bacterial infection with antibiotics. You could ring up for antibiotics. So look out for increasing temperature. When people are getting sick as well, the heart rate does tend to increase. So depends on the individual, but normally we say over 90 beats per minute at rest. The heart rate does go up though when someone has a fever anyway, so basically what you need to do is look at the trend and see if the heart rate is increasing, if there's an increasing trend. If there was a drop in blood pressure or the person was feeling dizzy, that would be a very concerning feature, as would reducing urine volumes be a concerning feature. So there's quite a few things we can look for there. And that means if you are concerned about a sick person and you call for professional help, you're in a position to give them really quite specific information on the condition of the person. Keep people comfortable, keep them dry, keep them clean, keep them warm. And do get help if you are uncertain in any way. So in my country we can ring 111. Most countries have helplines to ring. If someone's infected, we probably should, we don't want to be taking them into hospital unless we're told to do so, or to the doctors in case unless we're told to do so. So very often the first port of call is on the phone, unless you're particularly concerned and you think someone is in immediate danger, in which case of course you need to go on to a more emergency course of action. Most people with these respiratory viral infections make a full recovery on their own. It just takes time.